Good evening. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Rocky Mount Family Medical, and I am so excited tonight because we have the Nash Breast Care Center folks here to talk about breast cancer. You know, it's breast cancer awareness. You can see the beautiful scarf with the little, what do you call
Pink
that?
ribbon.
Pink ribbon. And so we're going to be talking about breast cancer. So this is a live show, so if you want to give us a call, 407-1111. That's 407-1111. So we're going to get started. This is Terry. She is the manager of the Breast Care Center. And this is Dr. McAlarney. And she is a, let's see now.
Breast Fellowship trained radiologist.
There you go. See, you know, they all know me. I can't do all that talking stuff. So anyway, we're going to be talking about that tonight. So I am really excited, and we're just going to start. I'm going to start asking a few questions. So McAlarney, Dr. McAlarney.
Kids like to say macaroni.
So how long have you been here in Rocky Mount?
I've only been in Rocky Mount a couple of months.
Oh, okay.
I'm really happy to be here.
Where did you come from?
Oh, I live in Raleigh. And
Okay.
I did my breast fellowship training at UNC Chapel Hill, and I've just been a few
Go
places
Heels.
in between. Yes, go
We
Heels.
won't talk about football.
No, because I'll have to go.
Yeah,
I'll have to
Clemson.
I'll have to talk about Gamecocks.
Oh.
Y'all don't want to do that up here in
No.
North Carolina.
All right. So you've come here, and we are just so blessed. You know, I am just blown away at all the services that we have at the Breast Care Center. For little old Rocky Mount, I mean, we have got top-notch talent there. So tell us about the incidence of breast cancer in our population.
So, in our population in North Carolina, or
Yes.
in general,
Well-
there are about 250,000 new cases of breast cancer each year. So it's a staggering numbers of disease. It is the most common cancer in women, second and followed by colorectal and lung cancers. So, and then there's a number here of 40. Where's the other number? About 40,000 breast cancer deaths a year.
Oh, man.
Unfortunately, that number is higher in North Carolina.
Yes.
In this part of North Carolina, we see, I don't have the exact numbers, but we do see more cancer rates in this area. And somewhere we have those numbers.
Is that partly because of the poor diet they have down here?
Well,
Now that I mention.
now that you mention, I've only been in this part of the state, working in this part of the state for a short time. So I don't know all of the answers, but what I do see is, number one, I think there's a lack of, I think there's under-ordering of annual screening mammograms.
Oh, okay.
I believe that the ordering providers here may still be using old recommendations, and the faulty recommendations that came out of the U.S.
Okay.
Preventive
We'll have to talk
Preventative
about
Task
that.
Force. Those recommendations have been studied at length and shown to not come from science. The task force actually did not use numbers, and the numbers that they did cite are from an extremely faulty old Canadian study, which has been
geez.
thrown out by the World Health Organization.
Oh, wow.
So I do believe there's under-ordering. We do hear from patients that their physicians did not order one the year before, and we do hear that more than I would like to hear.
Yeah.
So I know that that's one
I'm
problem.
probably guilty of that myself. I'll be the first to admit, you know.
Well,
I
we can
try to
talk
be on
about,
top of it, but
we have this. I should have had it so we could hold it up, but we'll talk about the rates and why 1 year can make a difference.
yes.
That's number one. The reason that we see more incidents here in this part of North Carolina. Number two, you're right. There is more obesity, which causes people to be the breast to be exposed to estrogen, which increases the risk of breast cancer. That's one. And there's a third that just went out of my head
Wow.
that I just anecdotally had thought of. You mentioned, what did you say? You said obesity, right? And
No,
poor
I
diet.
said
Yes,
poor diet.
Yes, and that goes with obesity.
Of
yes.
course, of
So-
course. Yeah, like the 350-pound 18-year-old I saw today who her mother doesn't cook. They eat fast food three times a day. I'm like, oh my God, she won't live to be
Yes,
40.
diet is
Yeah,
extremely
yeah.
important.
And I push health, healthy eating and drinking lots of water, and a Pepsi should be a treat. Rarely.
Once a year.
Yeah. Yeah. Well,
Yes.
I've been telling my people they can have Pepsi at Thanksgiving, but not
you
at
go.
Christmas. One or the other, not both.
Not both. Not both. Well, there is something to say about poor diet. With a lot of people believe that they can't eat well on a budget. So that's another issue.
Yes.
We need to teach people how to eat well
Yes.
on a budget, and you can do it. And it costs a lot more to be sick later in
Yes.
life than to eat well your
Yes.
whole life.
That's right. You're
So you
exactly
can
right.
spend your money when you're young. Well, you can spend your money on good food, good healthy food now, or you can spend it on medical bills and hospitals and all of those things later.
Yeah.
One, spending money on good food, you get to have a healthy, vibrant life. The other, the
You
money's
feel
still going to be
terrible.
spent, and you feel terrible, and you have a poor quality of life.
Yeah.
So it's a big ball
Yeah.
of
And we have in this area made some advances. Richard Joyner, who works at the hospital, I don't know if you've met him yet or not. If you haven't met him, you'll remember him when you do. He's a crazy guy.
He's our
great.
senior chaplain.
Is it? Yeah.
He's wonderful.
But, he started an initiative on healthy eating in Canida, which is like between here and Greenville. And he's got a huge farm, and he brought kids in, and he would pay them, and he'd keep half of the pay and put it away for their college fund. And,
That's
and
wonderful.
that has just gone on. And he was actually nominated for, the CNN does the Heroes once a year.
Okay.
Yeah.
I want to read about this. I would like to
Yeah,
read this.
yeah. So there
wonderful.
is some of that happening with community gardens and stuff like that. And,
That's wonderful.
there's various chefs or cooks that will go to senior centers, or like we have an organization here, Peacemakers, which is to integrate into the poorer communities. And they just had a chef come and teach them how they could cook.
That's great.
Yeah,
And
so
then
they're-
teaching gardening, teaching
Yes,
them how
yes.
to grow their own food would be a great.
And if you can get your kids in there to chop the carrots or something, then
right.
they're going to want to eat them. They get excited
That's
that
right.
they can do that. So-
That's been proven that the kids who help prepare their meals, healthy meals, eat a lot more of those meals. So, yeah.
So let me transition right into this bottle of water, since we're talking about health and nutrition. I have a bottle up here about every week that I'm here, and now I'm like, oh no! So tell us why we shouldn't be drinking bottled water.
So bottled water, the plastic in the bottle contains dioxins, which is a toxic chemical, and the dioxins in the plastic actually leach into the water, and they leach more the hotter that the water gets. If it heats up, and people leave them in their car, and that they
yeah.
are shipped across the country in crates.
yeah. Yep.
I mean, we could talk for a long time about the environmental impact of bottled water, but for cancer prevention, it's the harmful chemicals within
Right.
the plastic that
Right.
leach into the water.
Wow.
And we could continue this discussion and talk about all kinds of things that actually increase the risk of breast cancer.
Well, any processed food,
environment.
I'm sure does.
Lots of environmental chemicals, petrols,
Yes.
BPA in can linings, and lots of not a lot. There should be a lot more companies moving towards removing that chemical from their cans. So far, I only know of 3, and that is Eden Organic, Whole Foods, the 365 label, and Annie's Organic. Those 3 companies do not have BPA in their can linings. That's bisphosphenol A. I can't. One of those. So lots of chemicals. There are also chemicals in shampoo, conditioner, body lotion, cosmetics, cleaning supplies. Cleaning supplies are a big one. There have been some studies and lots of anecdotal evidence of this. And this is sort of a long,
Go
sort
ahead.
of a sideways.
That's all right. My God.
We see
We got a while.
cancers, breast cancers in young women under age 40, under age 30. And we ask, and a lot of times we go in and they're from a different country. And we say, okay, when did your parents move here? They tell us, when I was little, I was born in the U.S. Okay, did your mother or father work in other people's homes cleaning with chemicals? Yes, they did. There's something about the cleaning, all of the toxic chemicals in cleaning supplies being absorbed into the mother and causing something in the ovaries. So it's something about the connection to the mother's ovaries and the child, male or female, having increased risks of cancers, especially breast cancers. So it sounds crazy, but it's seen over and over again.
Yeah.
And if you think to ask, and if you do some,
Research.
a little bit of digging.
Yeah. Yeah. Well, I'll be harping more. I harp every week. Eat healthy.
Eat well.
Drink water, not in a bottle.
Yes.
And move.
Now, there's lots of, water bottles are a big industry now. The permanent one, the ones that do not have chemicals in the lining, the stainless steel.
Yes.
And they're so affordable,
Yeah.
usually.
Yeah.
And people should just, if you
Well,
just carry those with you,
right, right.
you can fill up at water fountains and fill up.
And
at home.
you're right, they're readily available. And it's less expensive if you get your water
yes.
that way.
Absolutely.
And then that would give you more money to buy some healthy food.
There you go.
I like that little segue.
All right. So what can we do to prevent breast cancer? Now, we've already talked about the diet and that kind of thing. Are there other?
There are lots of supplements that the breasts need that, that's not really studied by a physician taking care of, how many people do you see in a day?
25.
Okay. You don't have time to go and dig into some of these things,
All right.
but it has been one of my passions to learn about alternative care, vitamins, minerals, those kinds of
I love
deficiencies.
alternative care.
So there's a list of about, I don't know, I'd have to count, 8 vitamins and minerals that have been shown over and over with good research to be preventative against breast cancer. These are minerals that the breast needs in order to function properly. And I can list them now, but I will do a short list if you'd like. Would you like to hear the list?
Sure, I think.
Okay. So iodine is incredibly important for breast health. Iodine is used by the breast and the thyroid. Those are the 2 tissues in the body that use it. Those are really the only 2. And breast and thyroid health do go together. You can see an incidence of increased breast cancer in women with thyroid disease.
Really?
Yes. And there are lots of studies. That's one of the more commonly known minerals that we need for breast health. Okay, so iodine deficiency can contribute to increased breast cancer risk. So we need to make sure our iodine levels are normal. Zinc. The breast needs zinc. There are actually zinc fingers in certain parts of the breast, and it's a preventative measure to have the proper levels of zinc. Selenium, those 3. So iodine, zinc, and selenium are essential for breast health. But a few that people don't know about, melatonin. Low melatonin levels have been associated with increased breast cancer risk. And more people have low melatonin levels because of all of our bright lights at night. Okay? So when God turns out the lights, we're supposed to, right?
Right.
And when we have all of our bright lights on and our TVs and our screens and our porch lights.
Electronics.
Yes. Our bodies cannot produce the normal amounts of melatonin. So turn off your lights at night. For years I have dimmed all of my lights. As the lights outside go down in my home, we kind of put them lower and lower for bedtime, for dinner. And turn off your screens. Do as much as you can to eliminate light at night, and while you sleep, your room should be dark.
Yeah.
There have been studies that show even if you sleep with light sources coming in, a street lamp coming in the window, clocks, bathroom lights on. Those kind of things can disrupt the pineal gland's production of melatonin. So that's one that a lot of people don't know about.
Yeah. Wow. I didn't know.
And
I work in the health field. Shame on me.
No, and that's just it. Is the health field, our healthcare system has almost always focused on treatment rather than prevention.
Right, that's
and
right.
the medical schools still teach treatment first instead of prevention.
Right.
And we need to shift that.
Yes.
But that's what we're doing right now tonight.
That's right. That's right.
Vitamin D is essential. Vitamin D, lack of vitamin D, vitamin D deficiencies contributes to multiple different cancers and brain disease and renal disease and lung disease, lung cancer, pulmonary fibrosis, all kinds of lung disease. It's essential. So vitamin D levels need to be normal. And and on that same note, vitamin K2, D3 cannot work without K2. They need to go together. And then there's the last one I would say. There's two more. There's I think it's an enzyme. It's called diindolylmethane, and it's in it's in cruciferous greens like broccoli.
Oh, okay.
But you can't eat enough broccoli these
Yeah,
days. I mean,
yeah.
our soil
It's
no
so-
longer contains
right.
the nutrients
That's
to give us
right.
these
That's
vibrant vegetables that we used to have, right? Anyway, DIM is a supplement that you can take that decreases the risk of breast cancer. And lastly, progesterone, not progestin. Progestin increases the risk. And we kind of left that, but hormone replacement therapy increases the risk of breast cancer, and part of that is the progestin component. Progestin is a synthetic progesterone,
right.
And it causes all kinds of negative in the body, but natural progesterone is essential and does good things like lower blood pressure, decrease depression risk, those kind of things, and prevent breast cancer.
All right. Well, it's time for break number 1. See how fast it goes?
that was fast.
I know. So we will be back in just a few minutes with more of this fascinating subject about breast health. And don't go away. Hang on. If you got a question, give us a call, 407-1111. We'll see you in just a minute.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Hi, I'm Richard Koss, Pharmacy Manager at Allman's Drug Store at the Westridge Shopping Center. Here with my wife, daughters, and my business partner, Brad Hilton, and his wife, Katie. We are delighted to be new business owners living in Rocky Mount and are excited about the new services and products we are adding at Allman's Drug Store's 2 locations. With a full-service pharmacy, a large supply of over-the-counter supplements, and a comprehensive line of diabetic supplies, Allman's has you covered. Our pharmacists also specialize in consultations. We want you to pay the lowest prices and get the best service in town, and our staff works hard to help you save money, but we are also big on friendliness and customer care. We will deliver your prescriptions free, have drive-through windows, and guarantee short wait times. And we come out to greet you personally and see how we can answer all of your questions. Because as local business owners, we care about you. As a loyal member of your community for over 70 years, you can count on Allman's Drugs to make the health of you and your family our top priority.
Please call Almond's Drugs today.
443-3138.
Hey, we're back. That was quick, wasn't it? So here's Sugared Health. My name is Linda Prezioso. I'm a nurse practitioner at Rocky Mount Family Medical, and we are just so blessed to have members of the Nash Breast Care Center. Yes, and they offer so many services, and it's just absolutely awesome. And they got those names right. So we're going to keep on talking for a few more minutes. We're going to kind of break this up differently than normally we do on the show. So just sit there and listen, or call 407-1111. All right, so give me a short case for catching breast cancer as early as possible.
Okay, short case.
Short case.
Basically, catching it early can save. It does save lives. Okay, every day. I've got statistics I can throw out for you, but let's make it simple. Catching a breast cancer that's very small, less than 1.4 centimeters,
And that's really small.
That's very small, but it's readily visible on mammograms. The cure rate approaches 100%. Survival rate is almost 100%. I mean, we could say 100%. You're not supposed to say that for anything, right?
Right.
But the survival rate for small cancers is 100%. Now, that's a stage 1 cancer. Even when you move to a stage 2 cancer, which is less than 2 centimeters, now the survival rate drops to about 83%. You're already dropping by a good bit just by a small amount of growth in the tumor. Wait a little bit longer, and for stage 4 cancers, the survival rate is 22%. So you catching it early means the difference between a survival rate of 100% and 22%.
I'm going to go for the 100.
Let's be around for our kids.
That's right.
Grandkids,
That's exactly
families. And it's, again, the annual screening that we need. Because in 2 years, 2 years can make that complete difference. 100% survival versus. That's the simplest way to put it. There have been lots of studies about the benefits of breast cancer, and one number I'll throw out there is that this number comes up a lot in breast cancer, 40%. There's a 40% reduction in mortality in women ages 40 to 74 who are screened annually, who are in the screening pool. That's what we call it. They have a 40% less chance of dying of breast cancer than women who do not get screened.
Wow.
That's big.
So is there a time you can quit doing mammograms as a woman, or is that to the end of your days?
That's a fun question, or not. It really depends on how healthy are you. Okay, so if you have what's the word? If you have other diseases, if you're 80 years old and you are filled with other, that's the word I was looking for. You sort of have to take stock of what are the comorbidities that you have.
We have a call. Let's take this call. Hey there, this is Linda, Doctor, and Terry. I can't say her name. How are you?
We can just
Kelly.
call her
Okay.
Hey there.
Hey.
I had a question. At what age should you start getting your mammograms? Because I have 2 daughters, and they're up in their teenage years, but at what year do you do that?
Okay.
So
Question.
that's a great question.
We're going to hang up, and then Dr. Kelly will address this. Thanks for calling. Okay, go ahead.
So in a woman with no hereditary risk factors and no personal risk factors that would make you screen earlier, the general population starts at 40. And those numbers have been studied very well, and the reason for that is that there is a small radiation dose to the breast with mammography, and the risk of causing a cancer using radiation is more frequent in younger women, younger breasts, okay? And research over, 50 years has shown that age 40 is the right time.
That's the standard.
It's the right time, and that we can go back to a question from a bit ago. The task force that didn't use any science and used a faulty study to give most of their numbers said let's start at 50. Well, younger women between ages 40 and 50 get the worst cancers, more aggressive cancers. So for a 40-year-old to go every 2 years or to wait is very different than for a 50-year-old to wait.
Gotcha.
Okay? So that was, it's actually just a tragic recommendation to not start screening at 40, to wait till 50.
Okay.
So that's wrong. Start at 40 unless, now there are some factors, there are women who need to start earlier than that.
Sure.
Generally, you start 10 years before a first-degree relative was diagnosed with breast cancer. So if a mother is diagnosed at age 42 with breast cancer, then her children would screen starting at age 32.
Gotcha.
So let's put it that way.
Okay.
But
and
in general,
covers
it's 40.
all that.
Insurance covers all of
Okay.
that. Yes.
Okay. And I had a question in my brain and it left me, Tara. Oh, I know. What do you think about self-breast examinations?
That's a great question. Whew, can of worms. All right.
Oh boy.
In my experience, they're not all that helpful. Okay, I don't want to tell people not to do it.
Right.
But it should be done a certain way, and the way that we've traditionally taught self-breast exam can cause fear. It can cause people to. What happens is people feel normal breast tissue because we're having them move around too much. Okay, I believe in using just the palm of your hand in the shower once a month. So I say pick your birthday. So my birthday's the 5th of a month. So on the 5th of each month, in the shower with soap or shampoo and conditioner are actually better. You go over your breast with the largest part of your palm. You can use the 4 fingers, but we don't want movement of fingers all around. Okay, it's confusing. There are in Europe and in Canada and other places, doctors do not recommend it anymore.
I know. I read that.
But it's because of the methods that we've been teaching people to do it. I think if you use your whole hand, use the 4 fingers together, don't move your fingers around, that's a little bit of a better way to do it.
Right.
Incidentally, or anecdotally, most cancers are not found that way. Most
Right.
cancers are found, I was in the garden, I was gardening, and my elbow hit it. I'm running off the screen. Most women find it in a different way than the monthly self-exams. I mean, it's very occasional that's how
Right.
people find it.
Right.
A partner sometimes finds it. Sometimes they're visible. And sometimes it is in the shower washing, but you're not washing like, you're
Right,
not moving
right.
your
You
fingers
just
like
don't-
so. You know, your whole hand.
Sure.
Okay. But gardening is a big one. I don't know why. I've seen so many women find it while they're bent over in the garden with an elbow or a. So that's a long
What
answer.
about trauma to a breast, like a car accident, that the seat belt or the airbag?
Right.
Can that cause a higher incident or no?
We have not shown.
Okay.
No, it's that's not been shown that I know
Okay.
of.
Okay.
No. Now it can cause pain and it can cause breast
Right,
masses
right.
that they're basically hematomas. They're
Right.
blood in the breast, and you can feel that, but those go away.
Here's
with
another one.
time.
Let's take this one. Hey there, this is Dr. Kelly, Terry, and Linda. How are you? Hello?
Good. How are you?
Great. What's your question, Shug?
I just wanted to see if they could share what percentage of cases of breast cancer were genetic.
Oh, great
Is it-
question.
are you able to tell, a percentage of how many people get in that manner?
Well,
We're going to hang up, Barbara. Thank you for calling.
I could be wrong. I believe it's only 2%. It's pretty low.
Oh, is it?
And the statistic 1 in 8 women will develop breast cancer in their lives is still, that number is still pretty good. But the other number that a lot of people don't know is that 8 out of 9 breast cancers are not genetically,
Really?
they're not associated with genetics.
Wow.
And some literature says 6% might have genetics that
Okay.
plays a part in getting.
So 2 to 6%.
Yeah,
we
that's
see
what I would
different
say.
numbers. So it is a low amount. It is still a risk factor to have family members with breast
Right.
cancer,
Right.
colon.
Right.
There's still definitely
Yes.
a risk factor there.
Yes.
But what is important to know is that most women do not have that factor. Women who develop
Right.
breast cancer.
All right, caller, you're going to have to call back or hang up and call back. We've got to take another break. So don't go away. We'll be right back in just a few minutes. Bye-bye.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Hi, I'm Richard Koss, Pharmacy Manager at Allman's Drug Store at the Westridge Shopping Center. Here with my wife, daughters, and my business partner, Brad Hilton, and his wife, Katie. We are delighted to be new business owners living in Rocky Mount and are excited about the new services and products we are adding at Allman's Drug Store's 2 locations. With a full-service pharmacy, a large supply of over-the-counter supplements, and a comprehensive line of diabetic supplies, Allman's has you covered. Our pharmacists also specialize in consultations. We want you to pay the lowest prices and get the best service in town, and our staff works hard to help you save money, but we are also big on friendliness and customer care. We will deliver your prescriptions free, have drive-through windows, and guarantee short wait times. And we come out to greet you personally and see how we can answer all of your questions. Because as local business owners, we care about you. As a loyal member of your community for over 70 years, you can count on Allman's Drugs to make the health of you and your family our top priority.
Please call Almond's Drugs today.
443-3138.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Hi, I'm Richard Koss, Pharmacy Manager at Allman's Drug Store at the Westridge Shopping Center. Here with my wife, daughters, and my business partner, Brad Hilton, and his wife, Katie. We are delighted to be new business owners living in Rocky Mount and are excited about the new services and products we are adding at Allman's Drug Store's 2 locations. With a full-service pharmacy, a large supply of over-the-counter supplements, and a comprehensive line of diabetic supplies, Allman's has you covered. Our pharmacists also specialize in consultations. We want you to pay the lowest prices and get the best service in town, and our staff works hard to help you save money, but we are also big on friendliness and customer care. We will deliver your prescriptions free, have drive-through windows, and guarantee short wait times. And we come out to greet you personally and see how we can answer all of your questions. Because as local business owners, we care about you. As a loyal member of your community for over 70 years, you can count on Allman's Drugs to make the health of you and your family our top priority.
Please call Almond's Drugs today.
443-3138.
Hey there, welcome back. Look, I found more people. Isn't that awesome? This is Here's to Your Good Health. We are talking about breast cancer tonight. We have multiple representatives from the Nash Breast Care Center. Dr. Kelly wanted me to mention that there will be pamphlets available like within the next 4 to 6 weeks at the Nash Breast Care Center, outlining what she talked about with the vitamins and the minerals and supplements and things like that. So is that for anybody, or do you have to have your mammogram there? Anybody. It's for anybody. So,
But they should be getting their mammogram.
well, yes. And then the caller who just called, I'm so sorry I couldn't take your call. So please call back. I know you have a great question. Dr. Kelly is still here in the studio. We just have the mammographers here, and the mammographers are the ones that that use the machines and actually do the mammogram. And so we have Carolyn and we have Jackie, and I bet that's our call. Hey there, this is Linda. Here's Sure Good Health.
I wanted to know, how close a relative is it that you counted genetic cancer?
Okay. We'll address that. Did you hear that, Dr. Kelly? Okay.
That's a complicated question.
It's a complicated question.
There are different categories of risk. We do take into account maternal and paternal aunts.
Okay.
We take into account grandparents and aunts and uncles.
Okay.
Obviously and parents. So, yes.
I guess
So first degree and second degree relatives for sure.
Okay.
But I'm not a geneticist.
I know.
There are actually a lot of categories.
Okay.
The main risks come from first degree relatives.
Okay, so the main risk is from first degree relatives, which would be mom, sister, then we go to aunts and uncles, grandparents. So if your grandma had breast cancer and your mama had breast cancer, I'm sure we're going to be doing some genetic testing on you just to make sure. And they offer that at the Nash Breast Care Center. I'm so excited about that. We're going to be talking about that in a few minutes. So, girls, what kind of services do you offer at the Nash Breast Care Center? Carolyn?
But Carolyn, okay. We'll start with me. Well, we offer screening mammograms, of course. That's where we get 2 views of the breast, where we compress the breast from top to bottom and also side to side. We have the latest, which is the tomosynthesis, which most people know it as 3D. And so a lot of times patients ask us, what's the difference in 2D and 3D? So I sort of use an example of a loaf of bread. You know, people relate to food, so they'll listen to me when I talk about food, right?
That's right.
So I say like a loaf of bread. You know, that's like a 2D image where you see the image all at the whole bread. You see the image all at one time, the breast. Okay. With the 3D, you see the whole image, but then you're able to go in there and look at a slice. So with 3D, we're actually doing different levels of the breast along with the whole breast.
Okay, and that's pretty standard at the Nash Breast Care Center now,
standard,
isn't it?
yes.
Yeah,
yes. So
we're a screening facility where I work, so we don't have that. And I have plenty of patients who say, I want the 3D, and okay. I mean, you know, whatever they want, they can have as far as I'm concerned, within reason, of course. So, and so what about, I think you mentioned ultrasounds to me.
We do breast ultrasounds. We have lots of ladies that come in and they feel a lump or the doctor felt something, so we do the mammogram first, and then they have
You do both of them then?
It's a diagnostic workup. If they come in, they haven't had a mammogram, then we do both breasts. The radiologist looks at it. Then they have an ultrasound of what is, if they feel something, even if we find it on the mammogram or not, they still do the ultrasound. Mammograms are not 100%,
Right,
so
right.
mammogram and ultrasound kind of work together.
And do they, like if you have a younger girl that, you know, might have a cyst or something and you don't know what it is when I see her, do they ultrasound younger people's breasts or they just still do both?
Right. We try not to do a mammogram until you're about 30. And so if they feel something and they're younger than 30, then they automatically go to ultrasound first.
Yeah, I thought so because I've had people say, order the ultrasound.
Yes.
I'm getting there.
a lot of people when they come in just have the ultrasound, but they have to realize ultrasound is not a screening tool. So, but we do use that for the younger ones because they come in because they are feeling something, maybe.
Right. And so I suppose some of that is the fibrocystic breast disease, which is very confusing to people.
Yes.
You know, and I've had multiple young ladies, and I'll say, this is fibrocystic breast disease, and they don't want to listen to me, they don't want to hear me, they want to go see you, so.
They want that confirmation.
Absolutely.
That picture that says,
absolutely.
Here, everything
right,
is fine.
Right, and you can't blame them for that.
No.
But, you know, then I worry about insurance, because that's always a
a biggie.
problem. And do
It
you
is.
have any help for people that maybe don't have insurance or they haven't met their deductible? You know, deductibles can be $15,000 a year now.
Yes.
So is there some kind of help through the hospital for that?
There is. The hospital itself has charity care. We also have a breast care foundation fund that we use, and you're more than welcome to donate to that. We have
There you go.
a Facebook page.
So what's it called? The breast?
Nash Breast Care Foundation Fund. Sorry, I left that word out.
Okay. Well, I didn't know that.
Yes.
And that's good to know.
Yes.
Because there's plenty of people that have had breast cancer or their family members have, and they are passionate about helping, and this is a great way to help.
Yes, we have lots of schools that do fundraisers and donate money to it, and it's great because it helps the women who don't have the money
That's
to
right.
come and have that
That's
done.
right.
We also encourage you to go to your health department. They also have funds that help out as well.
Okay. And there used to be a free clinic here in town that Nash Hospital helped fund, and those people, if they needed a mammogram, Nash very graciously said, okay, we'll mammogram those.
Yes.
So I know that this goes back a long way, because some people, depending upon, finances or, stuff, life gets in our way, and life just, can be kind of tough. So now, any other things that you do? You do the mammograms and ultrasounds.
We also do breast biopsies. We offer that in stereotactic, which is with the mammography machine. We can do those lying down, prone, or either sitting up with the new 3D attachment to the mammography machine. We also do them by ultrasound. It just depends on the lesion, where it's at, what the radiologist feels is the best method.
And does the radiologist actually do the biopsy?
Yes.
Okay. And is it painful?
No, not painful.
It's uncomfortable.
Okay,
Yes,
it's uncomfortable.
Yes.
Okay, it's
they
uncomfortable.
use lots of numbing medicine.
Okay,
Yes.
yeah, that's great, because some of that numbing medicine is tough too. So, how long have you been there?
I've been there 11 years.
Okay, and Carolyn?
Oh. You would have to ask that question.
I know.
About 33 years, going on 34 years.
Were you always in the mammography part?
I started at the day hospital
Yeah, what
first,
used to be over there
right,
years ago?
and then we started mammography in '86, and 1986. Okay, yeah. So,
I had a kid then.
I had to say that part, but anyway. And so, and then in 2010, we actually moved the mammography out into the
the
building
day
where we
hospital.
in, right, into the building where we in now.
And so, do you take up the whole first floor, second floor?
No, we're actually on the second floor, but not the whole second floor.
Okay,
No.
okay. So about how many mammograms do y'all do a day? Does it depend?
It really depends. During the October, we usually stay pretty booked, but we have 3 rooms that we do cycles of 15 minutes scheduled. So we can do up to about 90 a day.
Really? Wow.
And adding in ultrasound also.
Yeah, and we also
Wow.
do ultrasound. So
Well, you girls are busy, ain't you?
we stay very busy.
You sure
But
do.
there's room for everybody.
That's right. And I'll tell you, as a practitioner, I have said, I really think this lady needs to get in today or tomorrow, and I've always had my request answered. All right, it's time for break number 3 or 4. I don't even know where we are anymore. I think it's 3. So don't go away. Think more about your questions. Dr. Kelly is still in the house, and she'll answer anything that you want to know. And so we'll be back in just a couple minutes with more of Here's to Your Good Health. Don't go away. We'll be right back.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently. So we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Hi, I'm Richard Koss, Pharmacy Manager at Allman's Drug Store at the Westridge Shopping Center. Here with my wife, daughters, and my business partner, Brad Hilton, and his wife, Katie. We are delighted to be new business owners living in Rocky Mount and are excited about the new services and products we are adding at Allman's Drug Store's 2 locations. With a full-service pharmacy, a large supply of over-the-counter supplements, and a comprehensive line of diabetic supplies, Allman's has you covered. Our pharmacists also specialize in consultations. We want you to pay the lowest prices and get the best service in town, and our staff works hard to help you save money, but we are also big on friendliness and customer care. We will deliver your prescriptions free, have drive-through windows, and guarantee short wait times. And we come out to greet you personally and see how we can answer all of your questions. Because as local business owners, we care about you. As a loyal member of your community for over 70 years, you can count on Allman's Drugs to make the health of you and your family our top priority.
Please call Almond's Drugs today.
443-3138.
Welcome back. Look, I've got new folks again. This is so much fun. It's like revolving chairs. I'm the only one that doesn't revolve. I've just sat here the whole time. So now we have Sterling Grimes, who is the
Director of the Cancer Program.
Okay, okay. And Terry's back with us, and she's the director of the Breast Care Center. So we wanted to just back up a little bit. We talked about the Nash Breast Care Fund, you know, if people are unable to get mammograms. But Sterling said there were other places as well. So address that for us, Sterling.
We just want to make sure everyone knows that at the Breast Care Center, we do work with 4 local health departments. So truly in Edgecombe County, Nash County, Halifax County, and help me out, Franklin, Northampton County.
Rural
I'm sorry.
Health Group,
If patients live in those 4 counties, as well as 13 rural health groups. So if patients are already associated with a rural health group, and I know they aren't as much in Rocky Mount as they are in north of us a little bit.
Because they don't have anything up there.
Right. But in Rocky Mount, we also work really well with OIC, and they actually have a Komen grant that they partnered with us on, and so we can help out through a variety of different fund sources available.
Great. That's great. So there's no excuse for anybody sitting out there that you don't get your mammograms. And I don't want to hear it hurts. I was going to ask the mammographers that, and I forgot. Now, it doesn't really hurt. It might be a little uncomfortable. But, you know, some people say, oh, no, I had one time, and I'm never having it again. It hurt. Well, and that maybe was because the lady that did it maybe was a little rushed, or I don't know. But normally, they're uncomfortable.
Well, we have the pink pad at Nash Breast Care Center.
Oh,
Terry touts the pink pad.
All right, tell us about the pink pad.
If you use that pink pad, if you ask the technologist for the pink pad, what it is a little piece of foam, and it doesn't show up on the mammogram, and it makes compression so much easier, not only on the technologist, but on the patient themselves. Compression is necessary to make sure that the breast is thinned out and we're seeing through the breast tissue, and to lower the dose of radiation that you have, but also we don't want to hurt you, so we want you to tell us if it's uncomfortable. If you're feeling uncomfortable, just tell the technologist and they'll adjust it so that it's not uncomfortable, because we don't want to scare anybody away.
That's right.
We want everybody to come every year and have their mammogram. That's the most important thing.
The pink pad. I have to remember that,
Pink
so I
pad.
can
So you
tell
can tell
my
your
ladies.
patients.
Yes.
That's right.
I'm going to remember that. All right, so we're going to kind of transition into some genetic testing and genetic counseling. Who wants to address that?
Well, were you going to talk about the breast center, how you get it kicked off over there?
So what happens is we're going to talk a little bit about how we first discover whether the patient actually needs to go for genetic counseling. Every patient that comes in the breast center gets a little form called the Personal Family History screening questionnaire. And what it does is it tells us that if the family history is significant enough, then we will send you or refer you to one of the geneticists, UNC geneticists that we have available at Nash, and they will counsel to discover whether or not you actually need genetic testing. And if you do, then they turn right around, draw the blood, send it off right away. We just have to have the order from the referring physician on hand to begin with before they go to genetic
So
counseling.
if I think somebody needs it, I can send an order over and then you'll determine if she really does?
Yeah, the counselor will.
Okay.
We have them fill out this form, and if it's determined by one of these significant risk factors, then they'll get a letter, and you'll get a report. Get it on the report. It'll talk about it's indicated that your patient has a family history of breast cancer that might be significant, and then they will be referred to the genetic counselor after they speak to you. We ask them to go to you, your patients to go to you to talk about whether you think they really, because somebody might say, they might be confused about an ovarian versus uterine. And what we need you to do is to dig that out and encourage them to go back and research their family history to see at what age this aunt so-and-so had breast cancer.
I probably need a copy of that.
Yeah, and we're
Right.
doing genetics with actually the School of Medicine at UNC.
Right.
So we have one dedicated licensed genetic counselor that we use through telemedicine to be able to offer that service on site. So she's not there technically, but she's there visually, and you can certainly hear and ask her questions. Her name's Julianne, and she's an excellent resource for us. But the reason people say, well, why don't we bring somebody on site? Well, the entire Bident system has 1. The entire UNC system has 3. Duke has 4. So there truly is a shortage across the country for genetic counseling. So we feel fortunate that we have dedicated slots a week that are ours to fill up.
Oh, yeah, because I can't tell you how many of my friends, patients, acquaintances had to go all the way to Chapel Hill, and have all that done. And I don't know how much it all entails, but it sure makes it nice if you just have to drive across Winstead Avenue instead of going
and we
all the
started
way.
offering this on site in March, and it's been really nice because we were using one genetic testing company, and they were able to help us see that there are many different types of companies, and what is best for Terry may not be best for Sterling. It's interesting to know who the payer source is, if it's a self-pay versus some kind of insurance, and looking at specifically what type of possible mutation a patient may have.
And also, they helped us go over
Critique
this
it,
form,
yep.
and critique the form and make it something that was very useful to them. So it doesn't just involve breast cancer. It could be other cancers. They're trying to seek out,
That's
because
right.
this is in coordination with the Cancer Center, and there's many other cancers other than breast cancer. So we want to try to help it all.
All right, well, we've got to zoom in on the Danny Talbot Cancer Center,
so exciting.
which is opening soon. So tell us about that. We only got a couple minutes left.
So if you've been on campus of the hospital in the past 6 months, you've seen that there's been fencing around part of Nash Day. Well, the fencing came down about 2 weeks ago.
Oh, did it?
Yeah, so you can actually, if you ride by at night now, you can see the window, the light coming through the windows in the infusion bays. But the center will officially open for all patients in January. So we have Dr. Laura Jackamore, the radiation oncologist.
She's fabulous.
Yep. She's been here more than 14 years. Yep. And then Dr. Austin Johnson, who's the new medical oncologist.
I've met her, but I don't think she's been on our show, but I've met her. She's very nice.
Very nice, very nice. And she started last summer. So the two of them, it will be their ship, but Dr. Boyette, who will be here next week.
Yes.
Dr. Austin is excellent at talking about palliative care and really goals of care at the very start of treatment.
Oh, that's
and
great.
Dr. Boyette will be they'll all share a space together. So,
Oh, great.
Yeah, we're really excited about it.
Yeah, they can brainstorm and that kind of thing. That's awesome.
So we'll be able to have a patient come for a lot of the head and neck cancer patients or colorectal patients who are having radiation simultaneously with their infusions. We'll be able to come to one location
Yes.
to have
Yes.
labs done, to have the chemotherapy, to have radiation. It really will be a very much patient-focused experience.
Well, and the thing is, I tell my patients all the time, I'm going to Duke, I'm going to Chapel Hill. You don't have to do that. You can stay right here. The services over there at the Breast Cancer Center and at the new Cancer Center, they are top-notch. And if you don't know what telemedicine is, I mean, that is kind of the up-and-coming thing.
It seems to be.
Yeah, when I worked in the ER, that was a long time ago, there was a hospitalist, and she was in Paris.
Wow.
And she was on call. And so she, you know, I don't know how they do it now. I'm sure they perfected it more. But, you know, the doctor would say, all right, put the stethoscope here, put the stethoscope here. And then she would ask the questions, and she treated the patient that way.
But that is good for someone who's not familiar. Telemedicine is essentially a video conference, and we have a video monitor, so you can talk back and forth as if you're talking through the TV to one another.
Yeah. Because I know they have it at Nash for stroke, too, so, and probably other areas as well.
Genetics, clearly, yeah.
Clearly, genetics, absolutely. All right, well, thanks so much for watching. Thanks, y'all, for coming.
Thanks
It's
for
been a
having me.
great show,
Yeah.
and we just want to really promote good breast health, not only in October, but 12 months out of the year. So we'll see you next week with more of Here's Your Good Health. Good night.
Good night.